To ask the Scottish Government what discussions it's had with trade unions regarding the impact of winter pressures on the NHS.
Cabinet Secretary Hamza Yousaf.
The Scottish Government continues to have regular and extensive engagement with trade unions in relation to the £300 million winter package. I met with trade union representatives on the 5th of October, the day of the announcement of that package. I also met with them most recently at a round table earlier this month. Our partnership model is designed so that decisions are informed by health and social care partners and, of course, in the best interests of patients and indeed staff. And the trade union and staff representative organisations are key players in that decision-making process.
Neil Bibby.
Thank the Cabinet Secretary for that answer. Last month I met with Unison reps at the RAH in Paisley who described in detail serious concerns about staffing and disruption to local services. Not just concern for the workforce but for the people they care for too. I shared those concerns with the Health Secretary in writing on the 8th of October and I've yet to receive a response. So will the Health Secretary today agree to meet with those frontline workers who can see the human impact of delayed screenings, appalling waits in A&E and explain to them why his recovery plan isn't working?
Cabinet Secretary.
I can apologise to Neil Bibby if there's been a delay in the response to him. I should say I met with Unison just last week, or forgive me, it might have been earlier this week that I met with Unison, so I'm more than happy to always meet with staff side representatives, but also staff. I look forward to visiting the RAH, of course, when it is appropriate. So I would be happy to do that. And as I say, I will get a full response. But I would say that the feedback to the £300 million winter package announced is that it can make a substantial difference if we, of course, are able to get those who are clinically safe to discharge out into our community and care settings. But in response to this question, of course, I will be happy to visit the RAH when it is appropriate.